Welcome again. And this time on a big story where we, take a look at some pressing issues impacting Nigeria today. And this one very important. The Nigerian government is currently considering suspending the 20% sugar tax on sweetened beverages, a policy initially implemented to curb excessive sugar consumption and generate revenue for public health initiatives. This potential suspension has sparked a heated debate over the implications of the country's economy and health, particularly as Nigeria grapples with high rates of obesity and diabetes. Supporters argue that lifting the tax could provide relief to the beverage industry, which has faced increased production costs, while critics warn that it may undermine efforts to promote, healthier lifestyles among Nigerians.
And so the potential suspension raises critical questions about the balance between economic growth and public health. The social tax was expected to generate significant revenue for the government, funds that could have been allocated to healthcare services and awareness campaigns. However, with rising inflation and cost of living challenges, many Nigerians feel the pinch, and the government faces pressure to ease the financial burden on both businesses and consumers. And so this debate highlights a broader tension between fiscal policy and health outcomes, challenging policymakers to find solutions that benefit both sectors. And so to provide deeper insights into economic implications of this policy shift, we're joined by our guest in the studio, Aghogho Udi. He's an esteemed economic analyst with Nairametrics, and he's here. He wrote a bit about this issue on the Nairametrics platform, and he's now here to give us more insight on this. Thank you so much for joining us.
Aghogho, good morning.
Thank you for having me.
I would like to start by saying, how would the suspension of the sugar tax affect, Nigerians, especially when it comes to the economy in terms of revenue generation and beverages industries especially?
Well, the tax is just a 10 naira tax on per liter of what we call SSB, sweetened sugar beverages. I think it was it started with the Finance Act of 2021. I think it was former President Buhari that brought it on board. And the goal was just to reduce sugar consumption in the country, especially with rising diabetes rates and all of that. So I think that's it. But in recent times, we've seen that the beverage industry, including manufacturers and all of that, have borne the brunt of recent economic reforms in this country. So I think the president or the federal government or the presidency is considering suspension of the tax to sort of provide a breathing space for them, because they've borne the brunt of increased energy costs in terms of electricity tariff hike, exchange rates, interest rate hike, and all of that. So I think that the federal government is looking for a leeway. I think, but when the Minister of Finance was speaking then, he said it's temporary, that it might be introduced later on after there seems to be sort of stability and balance in the economy.
I wanted to also really get to understand this sugar tax. It's 10% per liter.
No, it's 10 naira.
10 naira, 10 naira per liter. So if your average drink is 35 cl, it's not up to 10% per bottle. The 10 naira per bottle is not up to.
Not.
Now, the money is being extracted, or the tax is being paid for each liter. Where does the money go? Who benefits from that? How does the government use it? Okay,
the goal, we can't trace where these funds actually end up, but the goal, according to the policy or the Finance Act, then was to fund healthcare initiatives for building facilities for, it's not just diabetes, general non-communicable diseases like perhaps some heart infections, obesity, and all of that. So not just diabetes. I think it was geared towards that aspect and healthcare general, but we might not know where the funds are channeled to in the long run. Yeah.
Because Nigerian and our issue with transparency, isn't it?
It's not actually about transparency. It might be that they might just channel that from health sector to perhaps infrastructure or education or something like that.
Now, you talked about the obesity and the obesity debate in Nigeria and healthcare itself. I'd like for you to talk a bit more on how this would impact consumer behavior. Would there be a slight hike in price of sugar products? Would that somewhat help minimize our consumer behavior where we're purchasing and seeing all the sugar beverages in event centers and all the likes?
Well, I think the tax had been implemented sometime around 2022, although it was signed in 2021, but the implementation started in 2022, and there have not been any study to actually see perhaps a decline in consumption as a result of the increase in the tax. And the tax is pretty marginal. 10 naira per liter is pretty marginal. I don't think it's going to, in my opinion, I don't think it's going to shift or influence consumer behavior in the long run. I think that's why those in that sector, advocates in that sector, the health sector, are saying, oh, it should be increased to like 10%, 20%. So, because in that rate, studies in other countries like South Africa and I think one of this, Mexico and all of that, when they increase the sugar tax to like 10%, 15%, 20%, they saw a significant decline in consumption of sugar beverages.
Do you see that happening in Nigeria?
Well, there are a lot of stakeholders that, should I say, put pressure on government for their own interests. So perhaps we've seen perhaps the organized private sector manufacturers and those in the beverage industry will always kick against things like that because it's business and they make money from business. So, and they also have legitimate reasons for that. For example, the diabetes, total number of people with diabetes in Nigeria estimates though between 10 to 12 million, which is like it's just 6% of the general population of like 200 million. And in some countries like the UK, they have diabetes at 11%, the US at 11%, China 10%, India, and so on. So most of them are around double digits, while a lot of Nigeria is single digits. And also, I think the World Health Organization also said that consumption of sugar per capita in Nigeria is just around 8 kilograms, which is below the global average of 9 kilograms. So they have legitimate reasons to say, okay, we're still below the general consumption.
One wonders exactly what the aim was from 2021. You said since when
it was introduced in the Finance Act of 2021.
Yes. Yeah. So if these taxes have been introduced, where did the money go? Plenty of people argue that it should have gone to the health sector to help people, especially living with diabetes and all of the rest, sugar influence type of diseases, because they complain currently of a situation where prices in medication has skyrocketed and they have no way to live their lives without these drugs. So was there no concession given to these taxes being used for specific medical reasons, like to help aid people living with these diseases?
We can't tell for now because we don't know the total amount of money that was generated from that. So we can't actually tell if it was actually, perhaps it was probably used in funding those initiatives. It might just be that the figure, the amount was insufficient to actually meet their needs and all of that.
You said that our consumption of sugar is like a percentile below than world.
Nigeria's per capita sugar consumption is 8 kg, which is below the average, global average of 9 kg.
So just 1 kg.
Yes, 1 kg below, yeah.
And it makes me wonder, is it because of the social economic status of Nigerians? Not everyone can afford to have a soft drink with every meal or go out to get the sugar beverages. Do you think that is the case, or is it because of the regulatory for a certain amount of sugar for each drink?
Perhaps we can say both. Two truths can coexist at the same time. So it might be it might be lifestyle. Some people don't take a lot of sugar. I think there's also a lot of advocacy around it. So people have tend to reduce their consumption, perhaps once a month, once a week, and so on. So perhaps that's why the rate is low. And also, it can also be a funding issue, financial issue. People don't just have money to afford that.
It makes me wonder what will be the price when it comes to, what will be the percentile when it comes to alcohol intake as well.
Yeah, so there's no such application when it comes to alcohol, is there? Because the fact
there
is,
might be an alcohol
sweetened
tax.
drinks are not just the only source for sugar. Whether you like it or not, your beer also is
most of them are foods,
we don't even know
generally.
this.
Most of our foods.
Starch is sugar.
Yes.
The eba that you eat every day
sugar,
has plenty of sugar. So is there going to be a tax on Gary now anytime soon?
No,
I hope not.
No, there's not going to be a tax on Gary.
But then, do you suggest a situation where there is a balance between economic growth and public health?
Yes, there should be a balance between both. Yeah, we should. I think advocacy would go a long way to influence behavior of people, because I am of the opinion that to a large extent, increase in prices will not deter people from taking what they want to take. So some people, especially the avid consumers, increase in prices will not deter them.
There. I know the bottle of drink used to be what, 100 naira, 120? Now it's 350 naira.
And people still consuming. Yeah.
350 naira in Lagos. Outside of Lagos, it's much more expensive because the further you get away from the industries that make these drinks, the more expensive the logistics makes it. So you can imagine how much even the poor person, how much more the poor people who live outside of Lagos are
just
paying
drinks
for these drinks.
It might also be that because we live in the tropics, our environment is very hot, so people will most likely want those kind of drinks.
Drink water. But in the long run, will this cause any significant impact on whether health or the economy at all? Have we seen any significant difference from 2021 up until now since it was initiated?
There's no research on that now to get the data. Perhaps it might take a 5-year period for people to conduct a research to see okay, if prices have increased significantly or I mean, if consumption have increased significantly or decreased as a result of the tax. But I think the idea of the tax was looking at other countries. I think there are over 40 countries globally that have such kind of tax. So the idea of that tax was looking at what has happened in those countries with significant increase in with the tax and how it led to decrease in consumption. So I think that's why they are implementing such.
Do we have any such tax on any other commodity, like perhaps tobacco? Do we have such?
I think there used to be, there is. And I think there was also an alcohol tax, but I think it's administered by local governments. And a lot of them are not that effective in administering the tax, but I think there's an alcohol tax.
There was also a ban as well for the sachet, and look what happened.
Yeah, look at what happened. You see how the association stood by the people and all of that. They had to withdraw. I think NAFDAC have withdrawn it and say, okay, they'll bring it later.
Yeah. I saw the sachets. Anyway, Aghogho, this has been quite the very informative conversation we've had. I thoroughly enjoyed it. Thank you so much for coming.
Thank you very much, Aghogho.
Thank you very much.
Sharing and providing us your valuable insight in this very interesting topic.